Good day and welcome to the NCD Alliance webinar. Today's conference is being recorded. I would now like to hand the call over to Katie Dane, CEO of the NCD Alliance.
Good afternoon, everybody, or good morning, depending on where you are. Welcome to this NCD Alliance webinar on Wednesday, the 25th of October. Thank you for joining us. We have a busy agenda to get through, so if we could go to the next slide, please. Today we have speaking on the call, I'll be moderating the call. I'm the CEO of the NCD Alliance, Katie Dane. We also have from the NCD Alliance team, Elena Matska, based in Geneva, and Josiane Galea, based in London. And we have a guest speaker with us today, Gerald Younger, from the East African NCD Alliance, and is also a board member of the NCD Alliance. Next slide, please. So in terms of the agenda today, it's been a couple of months since our last webinar, so we've got a lot to cover mainly because a lot of things have been going on both at global and regional level. You'll all be very aware that obviously these last few months have been some of the first few months of the new term of the WHO Director General, Dr. Tedros, in his new role. And obviously during this time we've had the announcement of his new leadership team, which, as you'll all have seen, includes 12 Assistant Director Generals and including a new Assistant Director General for NCDs, Dr. Svetlana Axelrod from the Russian Federation. In addition, over the last couple of months, you all have also seen that WHO has put out a new general program of work, 2009 to 2023, which is out for consultation, and I'm sure many of us on this call have already submitted input into that, but obviously it's a key document of where WHO will be going for the next 5 years. And in addition, what the main focus of this call will be obviously talking about what's been going on in the NCD world, both at the global level but also at the regional level as well. So what we're going to cover today is 4 main areas. We're going to first walk you through what took place at the UN General Assembly in September in New York. Secondly, we will be walking you through the most recent WHO Global Conference on NCDs that took place just last week in Montevideo in Uruguay. We were there on the ground, as were many of the other people on this call. So we'll be giving an overview of what went down in Montevideo, what were the main outcomes, and what was being discussed. Number 3, we will be going to the regional level. Obviously, over the last few months, WHO have held their regional committee meetings, which have been very important from an NCD perspective, both in terms of the policy issues that are being discussed, as well as again seeing how Tedros is kind of positioning NCDs within these kind of political fora. And then finally, we will be going to an update on our Global NCD Alliance Forum, which is taking place in December, 9th to the 11th of December, to give you an update of where we are in terms of preparations and the program for that important meeting at the end of the year. So with no further ado, let me pass on to Elena Matska, who will be walking us through the update of the UN General Assembly from New York. Elena, over to you.
Thank you very much, Katie, and a warm welcome to everyone on this call. I'm standing in for my colleague Priyanka Nathan, who is our advocacy officer on the ground in New York, and I'll be walking you through a very short debrief on the UN General Assembly that took place in September. Next slide, please. The theme of the 72nd session of the UN General Assembly was striving for peace and a decent life for all on a sustainable planet. As per usual, during the general debate, heads of states and government delivered statements on their vision for sustainable development, and the recurring themes here are really conflict prevention, support for UN peacekeeping, sustainable development, human rights, and gender equality. This UN General Assembly was also the first for the incoming Director General, Dr. Tedros, to the WHO. And he was very present, attending lots of meetings and holding consultations with partners throughout. And in all of these events that he attended, and in keeping with his campaign parties, he of course continued to champion universal health coverage as a requirement for achieving the Sustainable Development Goals and as a critical component to global health security. For NCDs specifically, he really called on ministers of finance to engage in NCD prevention and control, highlighting their role in addressing the commercial determinants of health. He also specifically called on countries to ratify, but more importantly, implement in full the FCTC. He mentioned the dynamics between trade and NCDs in the food system and pricing as important aspects of the NCD response. And he also convened a group of civil society organizations, including the NCD Alliance, on the sidelines of the General Assembly to consult on the WHO's next General Program of Work. As you may know, the General Program of Work was open for public consultation. It was a draft concept note, and a draft will be put out next week on November 1st. That will then form the basis of a special session of the WHO Executive Board, which is taking place on November 22nd to 23rd in Geneva, and that's specifically dedicated to the next General Program of Work. Next slide, please. There's a number of side events during the UN General Assembly dedicated to NCDs. We ourselves hosted a side event focusing on the theme of implementing NCDs in the SDG era, convening a high-level panel including the WHO, the EAT Foundation, Women Deliver, Bloomberg Philanthropies, and also the UN Global Compact. And this panel focused on discussing the interlinkages between health and NCDs with other sustainable development parties such as nutrition, gender, and the environment to explore win-win solutions across these areas. The WHO and the government of Denmark hosted an event on NCDs inside UN headquarters, where the Minister of Development Cooperation of Denmark announced that Denmark will host a conference on financing for NCDs in April 2018. For anyone who hasn't followed this topic in detail, let me clarify that this is not intended to be a pledging conference, but the aim of the conference will be to come up with specific recommendations on financing for NCDs to be taken forward in the context of the 2018 UN High-Level Meeting on NCDs and commitments in the outcome document of the UN High-Level Meeting. At the event, WHO also launched the 2017 NCD Progress Monitor, unfortunately but not surprisingly showing that progress is still severely lagging across the board in terms of country implementation of commitments made in 2011 and 2014, and if we continue business as usual, we will miss not only the 2025 targets for NCDs, but also the 2030 SDG target for NCDs and the health target overall, health goal overall. Finally, the UN General Assembly saw the launch of the NCD Coalition for Access to NCD Medicines and Products. This is a multi-stakeholder coalition led by PATH, whose aim it is to address barriers countries face in procuring, supplying, and distributing essential medicines and technologies, and ensuring that they are used effectively. Next slide, please. As a number of other side events, the EAT Foundation and partners launched the Food and Land Use Coalition to address how to feed a growing world population and meet the world's climate goals. Women Deliver passed on the baton, so to say, from Denmark to Canada in preparation for the next Women Deliver conference in 2019 to be held in Vancouver, Canada. NCD Child held an event that focused on the environmental determinants of NCD and the perhaps underexplored importance of creating healthy environments for children and adolescents to help address the growing burden of NCDs among young people. And the Healthy Caribbean Coalition, the NCD Alliance partner in the Caribbean, launched their civil society childhood obesity action plan to guide the response of Caribbean civil society to the growing burden of overweight, obesity, and NCDs in the region. It's a very practical document tailored to the region specifically, but also relevant really to civil society in other geographies. And I very much encourage the participants of this call, if you're working on childhood obesity, to check out this document on the website of the Healthy Caribbean Coalition. To wrap up from a health perspective, the topics that were really highlighted throughout the week were, of course, universal health coverage, nutrition, financing for health, and broader global health security matters. On this note, I'll hand back over to you, Katie, to see if there are some questions.
Thanks, Elena. Just a reminder on the format of this webinar. So we have Q&A after each of the presentations, and if you do have a question, please do type it into the Q&A chat facility on the bottom left of your screen. We don't seem to have any questions related to the UN General Assembly at this point, Elena. I think we'll address the question from Gavi in the next segment of the webinar. So let's keep moving, and if anyone has any questions related to the UN General Assembly, obviously please feel free to type it in and we'll address it through the next Q&A segment. So thanks very much, Elena. Next slide, please. So let's move on from the UN General Assembly in New York to the WHO Global Conference on NCDs that took place last week, 18th to the 20th of October in Montevideo in Uruguay. Next slide, please. So just as a reminder, everyone will have no doubt been aware of this conference for a long while. It's been planned for the last kind of 6 or 7 months. The aim of the General Conference was to provide guidance to Member States on how to fast-track efforts to achieve the NCD targets. It was also aimed to launch a set of new global initiatives to help countries reduce the NCD burden in their countries. Thirdly, the conference also set out to really focus on kind of national experiences, good practices of what's working, what's not working at the country level, with a specific focus around policy coherence for NCDs, which is obviously very related to the Sustainable Development Goals and the fact that we're now talking about NCDs and health within this broader context of sustainable development. And then finally, the idea with the conference was really to try and help raise awareness of NCDs to political leaders, because obviously this conference is taking place, just under a year from the next UN high-level meeting on NCDs in New York in 2018. So it was being seen as a really important kind of preparatory meeting in the lead up to the 2018 high-level meeting. Next slide, please. Also, just a reminder, most importantly, this conference was hosted by the President of Uruguay, Dr. Tabere Vázquez, who has obviously shown immense leadership in tobacco control over the years, and now is really stepping up to take on the broader NCD agenda. So the fact that this conference was hosted by a head of government of their country was, I think, really quite important and sent a very strong message to other leaders around the world, whether they were there or not, that this really needs and deserves, higher level political kind of commitment and engagement on the issue. So going into the kind of details of who was there, firstly, in terms of participation, heads of government and heads of state, which, as I said, was one of the main objectives. We had the President of Argentina, of Chile, of Paraguay, obviously Uruguay, and Zimbabwe. We also had Princess Lala Salma from Morocco, who is a long-standing cancer advocate. In addition, there was a video message from the President of Finland, and obviously the President of Brazil was meant to be coming but had to send apologies just before the conference was taking place. So essentially what we had was 6 heads of government and heads of state in the room. In addition, there were 42 ministers, mainly ministers of health, but a couple from other ministries, and you can see the list there. It was much broader than, Latin America. We obviously had, ministers from Europe, from many other regions. I think obviously the ambition was to secure more heads of government and heads of state and more ministers. But actually being there and seeing this conference taking shape, it did show that, there was a really strong sense of leadership in the room, which I think was really important. And hopefully it did send a strong message to the ones that weren't there. In total, there were 429 participants in total. 87 of those were from governments, but there were also, importantly, UN agencies who were involved in the UN Interagency Task Force on NCDs, as well as obviously civil society and a small number of private sector, as well as philanthropic foundations and academic institutions. So it was quite a mixed and diverse participation and audience in the room. I would say that in terms of private sector participation, that was pretty limited to the private sector business associations that are in official relations with WHO. But it was great to see, as I said, kind of really strong presentation and participation from many governments around the world. Next slide, please. So in terms of the way that the program worked, just to give a quick overview of how the 3 days worked. Firstly, on the Wednesday, it was the high-level segment. And then followed by that, Thursday was a mixture of plenaries and workshops. And then Friday was really the kind of wrapping up of the conference. Again, more kind of high-level plenary sessions. So Thursday was much more interactive with lots of different sessions and discussions. Wednesday and Friday were a little bit more formal, obviously given the kind of the presence in the room. So to go into a little bit of a deep dive into some of these areas of the program, the high-level segment on the Wednesday included a session where it was purely the heads of government and heads of state who were in attendance in Montevideo. And I should say that no doubt many of you were actually watching this on kind of the webcast that was available. And also throughout that first day on the Wednesday, there were a number of different ministerial panels. And these were really impressive because it really showed and it gave an opportunity for ministers of health to be talking about, what's going on in their country in terms of NCDs and what are the good practices and what are I think there was a little bit less about the kind of barriers, but there was a lot about kind of, what's working in certain countries. Just an example, for example, we know that Sri Lanka is a long-standing champion of NCDs. And Sri Lanka, the Ministry of Health was there talking about their ambition to become tobacco production free by 2020. And in fact, Sri Lanka has actually committed to many of the global NCD targets, but with a shorter timeline, because they are implementing so many fantastic policies and seeing such great progress at the country level. But there were many, many other examples of what governments were talking about, and actually what NCD Alliance is doing now is we're going to be analysing and kind of trying to collate some of those good practice examples that came out from the conference. Importantly, obviously, Dr. Tedros gave a presidential address during this session, and he covered a number of different points. One of the main themes of his speech was really to focus on the importance of national leadership, and he obviously was really highlighting the leadership of Vasquez as a good practice example, both in terms of tobacco control, but also on the health system strengthening side in terms of a good practice example of universal health coverage in Uruguay. And he used that speech to really kind of call for more national leadership on the issue. He also talked about kind of needing to focus around kind of 3 goals, as he put it, talking about, number 1, protecting all people from products that threaten health. Number 2, to regard promotion of health as a responsibility for us all, as in not just for a Minister of Health, for all sectors in fact. And number 3, he called for leading a revolution for universal health and reducing premature mortality from NCDs from the highest political level. So again, trying to get at that political leadership point. He also, during that speech, made 2 announcements. One of them was that he announced the appointment of President Tabaré Vázquez as a co-chair of the WHO High-Level Commission on NCDs. And I'll talk about that a little bit in a minute. Obviously, we saw that high-level commission being announced at the WHO Eastern Mediterranean Regional Committee meeting the other week, with Sanja Nichter identified as the chair of that high-level commission. And now we saw in Montevideo that Sanja will be joined by President Vázquez as a co-chair, which is obviously fantastic and provides a real opportunity to continue the kind of legacy of the Montevideo conference and ensure also that the high-level commission will have a political focus as much as a technical focus. And I'll talk about that in a second. The second announcement, and we'll go into this in a lot more detail in my presentation a bit later, was obviously the surprise announcement that the president of Zimbabwe, Robert Mugabe, was appointed as a Goodwill Ambassador for NCDs in Africa, which came as a great surprise to everybody in the room. And obviously there has been a lot of media attention around that, and I'll talk about that in a little bit, about how we as civil society responded and obviously the kind of conclusions and the implications of all that. Next slide, please. Also, what happened at the high-level segment, so we're still on Wednesday here, was obviously the adoption of the actual outcome of the meeting. You'll all be aware that over the last few months, the Montevideo Roadmap, which is the kind of formal outcome of the meeting, has been negotiated in Geneva. It's been shepherded by the mission of Uruguay in Geneva with the support of Finland and the Russian Federation. It's been through many, many iterations, and it wasn't officially kind of launched and presented in public until actually this high-level segment on the Wednesday. And we all know that this negotiated outcome document is intended to really guide what happens next year in 2018. So for us, it was a really important and enlightening kind of experience to see the political dynamics at work with the Montevideo Roadmap. Let me pass back to Elena to give you a little bit of an analysis of what's in the Montevideo Roadmap and what was kind of pulled out of it in the last minutes.
Thank you, Katie. So as Katie already said, the outcome document of the Montevideo Roadmap was negotiated here in Geneva between June and September. And initially, the document was really meant to provide very concrete language that could be taken forward next year in the context of the negotiations of the outcome document of the 2018 UN high-level meeting. And I think that it was incredibly important that we had this opportunity of negotiating the Montevideo Roadmap now, that we had very, very focused engagement by member states on NCDs a year ahead of the 2018 UN high-level meeting, as there was a lot of issues and challenges that they came up in the negotiation of the UN high-level meeting. First of which most certainly was that given that it is the health attaches here in Geneva that negotiated the outcome document, there has been a lot of changes over the years in the missions here. And it was quite important to get everybody up to speed again on NCDs. So while I believe that the roadmap in itself is critical and quite positive in the light of strong reaffirmations of global NCD commitments, and also given that it highlights very important challenges to a stronger NCD response, such as industry interference and private sector interests taking priority over public health interests, the lack of high-level political leadership to make health promotion and NCD prevention control a whole of government issue, the lack of financing, etc. The roadmap does not include concrete commitments that we can now measure governments against. So there's, in my view, a lot of very positive progress that is reflected in terms of the acknowledgement of the bottlenecks and the challenges that we're facing, and also in the process of negotiating this roadmap in itself. It is still not a very ambitious document. In fact, it doesn't include a single concrete commitment. The commitments that governments are making with the adoption of the Montevideo roadmap remain very broad. Just if you followed the negotiations or have even participated in the public consultations on the draft roadmap earlier in August, you may be interested to learn that the call for a WHO Commission on Commercial Determinants of Health, which had previously been included, was removed in the final document. Similar, the previous draft, an early draft, included a call for a UN Commission on NCDs and the law. While NCDs and law is highlighted as an important area for more collaboration, especially in the context of the UN Interagency Task Force for NCDs, no specific call for a UN Commission was made. Perhaps more alarmingly for us is that the roadmap does not explicitly refer to WHO's best buys for NCDs, and the best buys is the set of recommended actions that can be taken by governments around the world that are most cost effective, and this document is also known as Appendix 3, so neither the best buys or Appendix 3 are referenced directly. And the document talks around the best buys by referring to cost-effective, affordable, equitable, and evidence-based interventions. And we know that the fact that the WHO best buys are not referenced is because it triggers a lot of unhappy memories to what happened at the World Health Assembly, where all governments endorsed the updated set of best buys for NCDs, with the exception of the United States. The document also stays largely silent on the important connection between NCDs and trade and investment agreements. In fact, trade is mentioned only once in the document in the context, in a very broad paragraph on the need for coordinated upstream action across sectors. On the positive side, the document does mention legal disputes as a tactic to prevent or delay or curtail regulatory and fiscal measures, so at least taking a bit of a stand here, but there's nothing specific here on trade and investment. And again, I think that also links back to WHO's set of best buys and the concerns from a trade perspective that certain member states have. It's very, very welcome from our perspective that the document takes up the issue of financing of national NCD responses in international cooperation for NCDs. The document highlights taxation of tobacco as well as other products. To note here is that we understand that there had been specific efforts from governments such as the Uruguayan government to mention specifically alcohol and SSB taxes along with tobacco taxes, but no consensus among member states could be achieved in the end. And civil society feedback on earlier drafts had also highlighted the need to disaggregate civil society from private sector in the final roadmap. These these two are lumped together under the term non-state actors, together with academia and philanthropies. And surprisingly, perhaps as well, the document only refers to the 2018 UN high-level meeting once, and that is in the context of a call to action to WHO, but there's no specific paragraph where governments commit to high-level multi-sectoral preparations for the high-level meetings, such as we saw in the Moscow Declaration ahead of the 2011 summit on NCDs. So I'll pause here and hand back to you, Katie.
Thanks, Elena. So yes, the Montevideo Roadmap being the formal outcome of the conference, and I think general message from us is governments can do a lot better, and we're expecting a lot better in terms of the 2018 high-level meeting. Otherwise, it will be a massive missed opportunity, really. Next slide, please. So, as I mentioned earlier, one of the announcements during that high-level segment in Montevideo was related to the WHO High-Level Commission on NCDs. As I've already said, Dr. Sanja Nishta, many of you will be very familiar with Sanja, being a long-standing NCD champion, and obviously was one of the candidates during the DG election in WHO most recently. And then obviously President Tiberi Vázquez has now joined her as a co-chair. In terms of what we know so far about the High-Level Commission, one big caveat of all of this is that this is obviously very early days, and one of the main reasons Sanja, I think, was in Montevideo, and it's fantastic to have her there, was obviously to be actually exploring what the Commission will really be focusing on. So everything on this slide is very much a kind of with a big caveat there. But what we have heard so far during particularly last week, and obviously what's come out in terms of the formal communication on the Commission from WHO itself, is that the idea of the Commission is to help guide preparations for 2018. That seems to be clear. And one of the areas that the Commission could help on, for example, is encouraging heads of government and heads of state to participate. Obviously, that's one of our main objectives from a process point of view for the 2018 high-level meeting. Quite a lot of discussion was had during the Montevideo conference of the fact that in 2014, at the high-level review on NCDs, there were absolutely no heads of government and heads of state in the room, and actually very, very few ministers of health, in fact. When you compare that to 2011, where we had around 35 heads of government and heads of state in the room, you can see a big difference. So it's really, really welcome that this high-level commission will have a strong focus on ensuring heads of government and heads of state come back to New York for the 2018 high-level meeting. Another thing we've picked up over the last week, and as I say, this is all with big caveats, is that it seems that the commission will focus on both the political and the technical. What that will actually look like will obviously depend on the kind of terms of reference that they come up with for the Commission. But I think it's pretty clear now, having Vázquez as a co-chair, that it does send a signal that this Commission will have quite a strong political focus, which, as I said, I think is really, really welcome. There was also discussion around this Commission focusing on supporting implementation of the WHO best buys. As Elena said, that was actually kind of missed off the Montevideo roadmap during the political negotiations. But obviously this is really what WHO is focusing on in terms of seeing progress towards 25 by 25. So perhaps this Commission will help support in that area. And another area that has been discussed this last week is perhaps the Commission will also focus on how to support the operationalizing of what comes out of the 2018 high-level meeting, i.e. whatever the big commitments and outcomes are from the 2018 high-level meeting next year, this Commission will help guide the next steps, which kind of gives an indication that perhaps this Commission will be longer than a year, perhaps. But again, this is all speculation really at this point. In terms of composition of the Commission, we've obviously got the two co-chairs. There are discussions that perhaps there'll be more co-chairs, Finland and Russian Federation being suggested. Obviously, we and many others are really suggesting that they need to have civil society around the table, which will be crucial. And then in terms of the specific deliverables, as it were, in terms of the Commission, a couple of things were mentioned last week. One of them was that there may be a report of the Commission as early as April next year. And this report may focus on, for example, some bottlenecks in progress towards NCDs, and actually coming out with some suggestions of what could be included in the outcome document for the 2018 high-level meeting. And then perhaps something following the high-level meeting itself. But as I say, this is all still very much kind of a work in progress, and we're looking forward to receiving more formal communication on this from WHO and the co-chairs in a not too distant future. Also, just to highlight that from Twitter, we've seen that Sanya has mentioned in Twitter that her and Vasquez met in Montevideo, and when we're talking about the importance of this commission being independent and being composed of experts with integrity, perhaps in relation to the other announcement that was made. And she's also said on Twitter that they will be identifying the other commissioners very soon. So I think we can expect an announcement on this in a very short time frame. Next slide, please. So just to continue to kind of walk through the official program, in addition to the kind of high-level presidential segment and the ministerial panel on the Wednesday, there was also an expert plenary which brought together a broader set of stakeholders. So Kelly Henning from Bloomberg Philanthropies, Dr. Ala Alwan, Vera from the FCTC Secretariat, Amy Youson from NCD Child, myself for the NCD Alliance, and Sir Michael Marmot, obviously, of the social determinants of health, all spoke. I think it was an interesting session because it really I think it highlighted some quite important changes in the way that the NCD community are talking about NCDs. One of the common threads throughout all of the presentations was really around human rights and social justice, which I think is very welcome. Another kind of common thread was the importance of more data and understanding actually what's happening at the country level, both from Dr. Ala Alwan and from Kelly Henning. Also, a kind of bigger focus again on kind of the patient story, particularly from us civil society advocates. And then obviously kind of more focus on the social and commercial determinants coming through that expert plenary. And then for the rest of the conference, what happened was Thursday, as I said, was a mixture of plenaries and workshops, very different format, much more interactive after the fairly formal first day with heads of government. And there were many, many workshops during that Thursday covering different issues, but all of them really focused on kind of innovative solutions and success stories and best practice at the country level. And then on Friday, the 20th of October, was when the conference closed. A few different plenaries took place on that Friday morning. One of them on innovative initiatives, which I'll talk very briefly about, as well as a kind of closing with some really fantastic speeches from many different people, including Ilona Kickbush on the commercial determinants, Sanya Nishta herself really talking about the high-level commission and her vision for what needs to be done to accelerate progress. Sandeep Kishore, who'll be very familiar with all of you from the Young Professionals Chronic Disease Network, where he really put a rallying call out for people to stop talking and to actually move into action. And Dr. Carissa Etienne, the regional director for PAHO, gave a really fantastic kind of, again, call to action for the need to kind of get moving. And she really reinforced the role of civil society in all of this as well, which was very welcome. Next slide, please. And then in addition to all of that, there were also 4 kind of side events. They really tried to avoid side events, but these were the 4 kind of part of the program. To kick off the whole conference, we had a Bloomberg Philanthropies event and reception on the Tuesday evening around obesity prevention. There was also 2 breakfast sessions, one organized by the NCD Alliance on patient perspective, patient voice, and patient empowerment. And then a second breakfast, which was organized by the Global Alliance for Chronic Disease on implementation research, which was really good as well. And then the whole conference was finished by a luncheon at the end, organized by NCD Free, really talking about kind of shifting the frame, which has obviously been an ongoing kind of discussion over the last year or so of how we can really kind of change the kind of framing that we're using for NCDs to try and generate more political priority for the issues. So as you can see, it was a really full program with lots going on, both official and obviously on the sidelines as well. Next slide, please. One of the plenaries, as I mentioned on that Friday, was of WHO promoting some new initiatives. Just to very briefly mention these, you'll be familiar with most of them. The Best Buys, they have now launched and published a publication which kind of packages this in a more effective way, really. So tackling NCDs, the Best Buys. Also, there was a presentation on the new initiative called Resolve, which is in partnership with Vital Strategies, Chan Zuckerberg Initiative, and the Bill and Melinda Gates Foundation, focusing on cardiovascular disease, which is also linked to the Global Hearts Initiative. There was also a presentation of the High-Level Commission on NCDs again, and also some mention of some really interesting regional collaborative initiatives, for example, the Americas and Caribbean Healthy Food Environment Network, and the Pacific are now creating its own network around the Ending Childhood Obesity Commission recommendations that came out of that process. So some really interesting initiatives. Many of them are familiar, and we're all aware of them, but it was really good to kind of get an overview of all of them and how they kind of connect together. Next slide, please. On the sidelines of the conference, the NCD Alliance organised a civil society meeting with Dr. Tedros, the new WHO DG. It was a great opportunity to sit down with him to talk about our own priorities and how we can work together. Obviously, this was partly in light of the surprise announcement on the Wednesday about President Mugabe as a Goodwill Ambassador. But we covered a whole range of issues. We obviously talked about the issue of Mugabe, and as 20 civil society leaders from both international, regional, and national, we were able to kind of really express our concern and shock at this appointment, not just from an NCD perspective, but also obviously from the broader kind of human rights perspective. It was also a great opportunity to talk to him about the 2018 high-level meeting to make sure that it was, on the radar at the very top of WHO. Which perhaps it hasn't been in the past, and to really talk about the focus on process, and particularly to try and focus a little bit on this discussion that seems to be going on at the moment around whether the outcome document for the 2018 high-level meeting should be discussed in New York or Geneva, and we'll go into that a little bit later. Also, given that the general program of work for WHO is out 2019 to 2023, and obviously as the NCD community, as many of us have expressed in our submissions to the process, we are pretty concerned that NCDs are very far down the list of priorities in the GPW. Some might say that it's kind of buried in there. We were able to obviously kind of amplify that message directly to him. And also to kind of raise the fact that it's a great opportunity for WHO to be doing more around the kind of commercial determinants of health, which is obviously a kind of growing issue and concept as well. And then finally, obviously, to talk about collaboration of how we're working across WHO and civil society, not just at the headquarters, but also through the regional offices and the country offices, to make sure that civil society isn't being seen as some kind of tokenistic tick box exercise for WHO, that we're actually fully engaged and being seen as a partner. I think it's fair to say from that meeting, it was clear that Dr. Tedros was really in listening mode, and I think he really appreciated the opportunity to meet with civil society. In his closing speech of the Montevideo conference, he actually highlighted the fact that he had met civil society a couple of times through the conference and been very impressed by the expertise around the room. And to be honest, this kind of meeting between civil society and the WHO DG is pretty unprecedented, and I think it shows his belief and interest in working across different sectors, which again is very much welcome from our perspective. Next slide, please. Getting to the issue that perhaps is of most interest to people on the call. So obviously the conference as a whole got fairly overshadowed by this surprise appointment of President Mugabe of Zimbabwe as a Goodwill Ambassador. As I said, this was announced in the high-level segment on Wednesday. The NCD Alliance organised a joint civil society statement. We were working with many civil society organisations present in Montevideo. We were able to act very quickly and mobilise and galvanise a strong civil society response. In the end, we had 25 plus organisations signing on to it. and obviously expressing our dismay and concern at this appointment. And we were able to get it out just before the conference was finishing on Friday. Obviously, in response and following that, what we saw was this really significant widespread international media coverage of the issue, and many opinion leaders really kind of expressing a similar concern. And so there was obviously increasing pressure of the WHO DG over the weekend to really kind of, reconsider and rethink the approach. Obviously, what we saw following that was on the Saturday, we saw a tweet from Dr. Tedros saying that he was going to be rethinking this approach and this appointment. And then we were really relieved and pleased to see that on Sunday morning, the DG issued a statement where he rescinded the appointment completely of President Mugabe as a goodwill ambassador for NCDs for WHO. Following that, and including in this statement with some of the kind of key sentiments of Tedros in the statement, was that he had listened and he had, really heard the views of many, which I think is a good sign as a leader. But one of the things that he kept coming back to during the meeting, and I think he was talking about in his statement as well, was the need to kind of build bridges and to be working with many people on NCDs and global health more broadly, which very much links to obviously Tedros' one of his key kind of campaign priorities about making health and WHO much more political. And following the announcement of rescinding the appointment, then you'll have seen that the NCD Alliance issued a response to that decision, obviously applauding it and stating the importance of having some clear criteria of actually what a WHO Goodwill Ambassador means, as well as obviously ensuring that we need to see high-level heads of government and heads of state stepping up, but not at the cost of integrity and human rights and other things. So this was kind of how the kind of few days panned out on the Mugabe scenario. Next slide, please. So in terms of the kind of conference media coverage, I think it's fair to say that there was obviously huge media coverage of NCDs for the first time. I think this is probably, from when I've been involved in the NCD response anyway, seems to have been the first time that we have actually seen NCDs receive that extent of international media coverage, which is obviously not the ideal. We wouldn't have wanted to see international media coverage on this particular issue, but it has got NCDs into the kind of into the spotlight in some way. And what this meant in terms of the media coverage of the conference itself is that obviously it's been dominated by the Mugabe appointment, which in a way is obviously a real shame because we had some really important political leaders in the room, such as Dr. Tiberi Vasquez and his fantastic commitment to tobacco control and NCDs. And so we're obviously really trying to make sure that the conference isn't completely overshadowed by that Tedros made the right decision following having listened to people and different communities. But what we need to do is really try and keep the spotlight on the need for others to step up in the vacuum that we have in terms of political leadership. Next slide, please. So just to kind of take a step back, the main takeaways from our side in terms of the Montevideo conference, just to run through these quite briefly. Firstly, obviously, as I've said, really promising to see some high-level political leadership on NCDs, and the work and commitment of Vasquez can't be said enough, really. But obviously, in terms of the numbers of heads of government there, it was very much Latin America, which was fantastic, and it was a testament to Vasquez's, diplomacy to be getting his neighbours to the conference. But we obviously need to work that well beyond Latin America to all regions. But it's a start, and it's something that we can build upon. Number two, I think the conference really did a good job of showcasing successes at the country level, particularly from governments themselves, from ministries of health, focusing on kind of what works. This is what so many governments are really wanting to hear. We can't always paint the really dismal doom and gloom story. We actually need to be talking about some of the successes that are taking place to kind of incentivize others to step up. Thirdly, I think what we saw from the Montevideo conference was a greater acknowledgement of what actually the bottlenecks are. And this was, coming out in some ways through the Montevideo roadmap, but also much more in the actual discussions at the conference itself. And one of the major themes that kept coming up in terms of bottlenecks was this question of financing. So it's fantastic to see the government of Denmark stepping forward and saying that they will be organising this financing conference in April next year. Number 4, the Montevideo roadmap in many ways was a kind of road test of what we can expect next year in New York in 2018. And I think this was a bit of an eye-opener for us because we saw immense pushback from many member states on anything that was vaguely ambitious, vaguely new, even things that had been committed to in the past, for example, the Best Buys. So pretty alarming in terms of the political dynamics that were going on around the Montevideo roadmap. Number 5, the Mugabe appointment was, obviously a unfortunate scenario. But I think in terms of a silver lining of it, I think it showed that civil society can move quickly and we can coordinate, which I think will be so important for the 2018 high-level meeting. The fact that we were able to put pressure on and kind of help trigger the international media response shows the kind of the power that civil society can have in these kind of scenarios. Number 6, we saw the WHO DG in action, probably at the closest that we had done so far. And I think we were, surprised and happy to see that he was very open to listening and working with civil society, as that meeting and other examples showed throughout the few days. And then finally, most importantly, which I'll talk about very briefly now, is the urgent need for coordinated advocacy on the process for the 2018 high-level meeting on NCDs. Because what we saw during that conference is that we were talking about the process for the 2018 high-level meeting, and there are many alarm bells that are ringing in our heads anyway in terms of the process, which I'll talk about on the next slide. Just to kind of go into that very briefly, the 2018 high-level meeting, we as NCDA and many others used this conference as an opportunity to really push home many of our process priorities for the 2018 high-level meeting. You'll have heard these from us many times before. Number 1, it being high-level, heads of government, heads of state. Number 2, it being a 2-day meeting taking place in September, just before the UN General Assembly. Otherwise, if it happens in June or July, we'll struggle to get the heads of government in the room. Number 3, in terms of the outcome document being strong and robust and having new commitments by governments. And then number 4, obviously civil society's involvement, and we're calling for a UN civil society task force that will inform the President of the General Assembly on the deliberations of the 2018 high-level meeting. Now, what was clear during the Montevideo conference was that some governments are pushing for the negotiations of the outcome document to take place in Geneva, rather than in New York, which has obviously been the standard, and it's been how all high-level meetings have taken place for health over the years, starting from the HIV/AIDS one in 2001 until today in 2017. It's hugely concerning that some governments are pushing to have the deliberations and the negotiations in Geneva. The reason why they want it in Geneva is because there is more capacity within the missions in Geneva from a health perspective. And they're saying that there's less capacity in New York on health. But obviously there's no point in holding a high-level meeting in New York if all of the deliberations are going to be happening in Geneva, because it will basically make it a much more of a technical meeting, as we saw with the Montevideo roadmap, which was negotiated in Geneva and wasn't as strong and as political as we wanted it to be. And also one of the reasons why we've been pushing for high-level meetings over the years is to take NCDs from being a health issue to being a whole of government issue, to be a highest political level issue, and to being a development issue. And obviously the worry is that if the outcome document gets negotiated in Geneva, it will predominantly be a health document and a technical document. So these are kind of some of the issues that we need to be working on over the next few months, really, really hard and really coordinated, and it's very urgent. So just a few other points in terms of the high-level meeting that came out. In one of his speeches, Tedros was talking about the appointment of the Goodwill Ambassador, even though it has been rescinded, as the start of many other ambassadors and champions that WHO will be working with. And he very much opened it up to us all to be, suggesting who these political champions for the 2018 high-level meeting could be. So we as NCDA are going to be working on a list of these kind of political champions, and would really welcome your input into that, given that in different regions you'll have much more knowledge and kind of insights into what's going on at the political and health level than we would. Thirdly, mobilizing political blocs. I think what came out pretty clear from the Montevideo conference with the appointment of Mugabe is, obviously individual political champions are really, really crucial, but we also need to look at the broader political blocs as well. G20, for example, with under the presidency of Argentina next year. This year, G20 under Germany focused on global health for the first time. Can we ensure that the Argentinians continue that focus next year? And NCDA and many others are coordinating advocacy on this at the moment to make sure that we generate the priority that NCDs deserve within that broader global health agenda. Also the Commonwealth Heads of Government meeting taking place next April in London. We are doing advocacy towards that, and there are many other political blocs, but really, really important to get NCDs into these kind of political discussions, as well as individual champions. Also to raise awareness on financing for NCDs. It was mentioned again, this Global NCD Financing Conference that will take place next year in Copenhagen under the leadership of Denmark, which is fantastic. But from now until April, we've got very little time. And if we actually want to see a conference that ends up being more than just words and discussion about the lack of funding, and actually coming out with solutions and recommendations, we need to get going yesterday. So this is going to be a big priority for us as the NCD Alliance, and I hope many others on this webinar. And then finally, in terms of actually what are going to be our outcome priorities for the 2018 high-level meeting. So far we've talked a lot about the process, which is absolutely key. Now as NCD Alliance, we'll be moving much more towards the outcomes. We're going to be presenting and launching our priorities for the outcomes on 2018 at our forum later this year in December. We'll be issuing a survey to our network very soon, where we'll be getting your input and your suggestions of what we should be focusing on. But this is going to be a really important part of our campaign for 2018. Next slide, please. And then finally, just a brief, I've kind of covered this already, but another kind of takeaway is trying to kind of leverage the media interest in NCDs due to this kind of surprising scenario that took place, and actually trying to kind of shift it to actually say, yes, we've had an outcry from many heads of government and heads of state about the Mugabe appointment, but actually who's stepping up in his place? And so trying to leverage the interest both from a media perspective as well as from a political perspective to get NCDs higher up the political agenda. And so we would really appreciate your support in doing that at the national level, because that's where it really needs to happen. Next slide, please. So that was a fairly long summary of the Montevideo conference. Apologies if that was rather long, but there was a lot that happened, and we wanted to make sure that we did a full kind of review of what was taking place during the conference for everyone. So let's move into the kind of questions and answers for the Montevideo conference. I think Elaine is going to answer some of these with me as well. So we've had a question around what does it mean that there were so few heads of government and heads of state from countries like the US, from Canada, from the EU. Elena, do you want to take that?
Sure, Katie. I think there's both kind of logistical aspects to this question and its answer, and then obviously political. And I think one of the basic problems with the organization of the conference was the incredibly short timeline, and the invitations only went out this summer, and to get a head of state to a global conference with just 3 months notice is incredibly difficult, as anyone on this call working in government will be able to confirm. Many heads of state and heads of government have their year planned well in advance. Then obviously we all know that there currently isn't a widespread political leadership for NCD. So in many ways, it's just a reflection of that fact here as well. And then obviously, given that President Vasquez is from the Latin Americas region, obviously his reach is much stronger in the region than it is beyond that. We also understand that there was some governments took had slight issues with the sort of formalities of the invitation process, that it wasn't professional enough, or that. So there are all these logistical aspects, and then most certainly though as well we know that a lot of high-income countries either haven't prioritized NCDs at home, and in extension haven't prioritized them in their development cooperation, and so attending this conference was certainly not on their list of priorities. And then similar to the issues with around the best buys, there's really having comprehensive NCD responses at home, but also abroad, does touch on broader issues around trade and NCDs, around economic issues, etc. And I guess it's a reflection of many member states not willing to go there as yet. And another, and I'll stop here then, is that I think getting ahead of stage to both Uruguay and to the 2018 UN high-level meeting is quite difficult, and I can imagine that there was also a lot of there was a certain prioritization of the 2018 UN high-level meeting over attending the Uruguay conference. So I think, as I said, a lot of very practical, pragmatic reasons as well as political.
Thanks, Elena. We also had a question around, is there a written document on outcomes of workshops, lessons learned, and best practice? What we know is that WHO is currently kind of collating a lot of the notes from the rapporteurs in the sessions, and they'll be sending around documents in the coming days to participants, and they're also available on the app for those that attended the conference. But no doubt WHO will also be publishing a lot more on their website as well in the coming days. So I think within the week we can expect a lot more kind of the formal summaries of sessions available online as well. I'm conscious of time because we have a lot to cover still. Just a quick question regarding, are there key gaps in 2011 and 2014 in the Montevideo roadmaps that you would want to build on? I'll address that fairly quickly. Thank you for the question. I think it's clear that from our perspective, the Montevideo roadmap was a bit of a missed opportunity, really, because it ended up with a fairly toothless document with, as Elena had said, there's no specific commitments in there. There are a lot of words on a piece of paper, but actually in terms of the new commitments, it's pretty sparse. Obviously, 2011, the high-level meeting and the political declaration was kind of the first time that NCDs were discussed as a political issue. So we ended up with a document with 22 action-oriented outcomes. 2014 was where we saw this shift with much more of a focus on national commitments and national targets, national NCD plans and targets, for example, implementing best buys. What we want to see in 2018 is a really strong focus on the national, because we feel like at the global level we have got the global architecture for NCDs, we've got the action plan, we've got the targets, we've got the global coordination mechanism, we've got these things in place. Now it's very clear that where the progress is lacking is country level implementation. And so whereas the 2014 high level meeting, put a target for governments to implement the best buys, we know that that's not happening. So we really want to see some more time-bound, specific national commitments coming out of the 2018 high-level meeting. And as I say, in terms of what we're going to be pushing for in terms of the outcome, this will be, through consultation over the next few months with hopefully everyone around this webinar, be launched in December of this year from the NCD Alliance anyway. A couple more questions are coming through. A question around mental health inclusion. How was mental health included in the SDG 3.4? And could it be a route to the 2018 General Assembly? From my perspective, it was interesting to hear Tedros, whenever he was talking about NCDs, he was always referring to it as NCDs and mental health, which was really welcome. He also recognized that the UN Secretary General has indicated an interest in mental health as an issue, very much closely connected to his interest in humanitarian and fragile settings. So the fact that the UN Secretary General has kind of raised this as an issue that he is interested in, and obviously mental health and non-communicable diseases very closely connected, is a very interesting kind of avenue into getting the UN Secretary General more interested. I think the other thing just to note in terms of the Montevideo conference is that there was a specific session on mental health. And that might sound like an obvious thing, but actually I heard from a few people that this was actually the first time there was a dedicated mental health session at an NCD conference by WHO. So again, I think this is beginning to move, and increasingly the NCD community is recognizing the importance of NCDs, mental and neurological disorders, which is what we as NCDA anyway have been kind of talking about for a while. But it's good to see this gradual kind of recognition for the issue, which is so important. I think we need to move on because I'm conscious of time and we've only got half an hour left. So we will follow up on the remaining questions via email. And thank you very much for all of the questions. No doubt it was an interesting week for us all in the NCD community. Let's move on. Let's move on to the next agenda item, which is an overview of the WHO regional committee meetings that have been taking place from September through to October. Let me pass over to Josie Angalea from the NCD Alliance to give us a run-through of a few of these regional committee meetings.
Thank you, Katie. So as Katie said, I will be speaking about the WHO Regional Committee meetings this year on behalf of Jessica Beagley from our team. Basically, the RCMs are an opportunity for WHO member states to adopt global agreements and action plans to the regional and national level, and we were lucky enough to have some representatives present this year. Before I start, I'd just like to say that the slides will be available later and the links will be working, so I'll just sort of go through a summary and a broad sweep of the relevant agenda items for NCDs in 4 of the regions before handing over to Dr. Gerald Yonga, who will present on Afro, and we will follow up with the WIPRO summary later on, along with a full summary that will be online for you to read in detail. Next slide, please. So firstly, WHO CIRO Regional Committee meeting took place in the Maldives on the 6th to the 11th of September, and we were represented by Ms. Prachi Katuria of Her Day and the Healthy India Alliance on the delegation of the World Cancer Research Fund International. There were sort of 5 relevant themes that came up at this meeting. Firstly, alcohol control. There was a progress report that showed Bhutan and Sri Lanka have adopted national alcohol policies in the past 3 years, and it noted industry interference as a challenge. Next, SDGs and UHC came up. Member states will define actions related to organizing, financing, and staffing health services to make primary care services more fit for purpose for new health needs. And a decision was adopted on progress monitoring on SDGs and UHC. Thirdly, patient safety was brought up, and a progress report on patient safety contributing to sustainable UHC revealed that measures to ensure and monitor patient safety are severely inadequate, and followed up by action by member states. Fourth, access to medicines, actions for individual member states, EML, procurement, pricing and monitoring, but also greater inter-country cooperation, including information sharing on price and medicines quality. Finally, climate change was brought up. The Malé Declaration on Building Health Systems Resilience to Climate Change was adopted, and we also note that there were joint CSO statements by the WCRF, Healthy India Alliance, and NCDA on SDGs and UHC and alcohol control. Next slide, please. The Euro Regional Committee meeting took place in Budapest, Hungary on the 11th to the 14th of September, and also with 5 relevant themes that came up. Firstly, there was a progress report on implementation of the European Mental Health Action Plan. This program currently collaborates with 25 member states in the European region. There was also a progress report on implementation of the European Action Plan to reduce the harmful use of alcohol 2012 to 2020, where 38 member states of the 53 reporting member states have written a policy on alcohol. Third, there was a progress report on implementation of the European Food and Nutrition Action Plan 2015 to 2020. Taxation and incentive measures to promote healthy diets have been adopted in the 6 countries listed on the slide. Fourth, a roadmap was adopted to implement the 2030 Agenda for Sustainable Development, building on Health 2020, based on key principles including sort of advanced government leadership, leaving no one behind, prevent disease through multi-sectoral policies, establishing healthy settings, and health system strengthening. Finally, access to medicines came up, focuses on collaboration between member states in the areas of pricing and reimbursement, strategic procurement, and information sharing and mutual learning. Next slide, please. The MRO Regional Committee meeting took place in Islamabad, Pakistan on 9th to 12th October, and the NCD Alliance was represented by Moya El-Zawawi of the Jordan NCD Alliance and also FCA board member. NCD prevention and control came up, and the high-level commission on NCDs was announced, highlighting only 9 of 22 countries have adopted and endorsed national multi-sectoral action plans, and 6 out of 22 have set targets for 2025 based on WHO guidance. Second, a resolution adopted on regional framework of action on cancer control and prevention, around 4 actions for member states on cancer prevention policies, programs, early detection, monitoring and evaluation, and sustainable financing. Thirdly, there was an agenda item on scaling up mental health care. Jordan, Qatar, and Tunisia are due to develop national action plans to address dementia in accordance with the provisions of the WHO Global Action Plan on the public health response to dementia adopted at the World Health Assembly this year. Fourth, focus on environmental issues were also raised, including a resolution adopted on climate change and health, a framework for action. Fifth, there was a paper on operationalization of the adolescent health component of the global strategy for women's, children's, and adolescents' health, and made good reference to life course approach to preventing NCDs. The resolution was also adopted. Dr. Fikri called for participation in the 2018 high-level meeting, encouraged delegates to sign the FCTC illicit trade protocol, urging them to be part of the upcoming meeting of the parties. Dr. Fikri was also extremely open to working with supportive civil society, and he's greatly missed. Next slide, please. The WHO PAHO meeting took place on the 25th to 29th of September in Washington, D.C. They're strengthening tobacco control in the Americas came up through a strategy and action plan. There was also the Sustainable Health Agenda for the Americas 2018 to 2030. One of the 11 goals was reducing morbidity, disabilities, and mortality from non-communicable diseases, injuries, violence, and mental health disorders. Finally, human resources for UHC was brought up. Member states adopted a strategy on human resources for universal access to health and universal health coverage. There were statements by the WHF and IAHF and UICC supported by the NCD Alliance. As I said, we will upload a summary of WIPRO, and I would now like to hand over to Dr. Gerald Yonga to tell us about the AFRO Regional Committee meeting.
Thank you, everybody. My voice clear?
Yes, we can hear you, Gerald. Yeah.
Yes. So I would just like to go through first slide, please. I would like to go through the recent advocacy milestone meetings for Afro region. Let me just remove my microphone. Okay. In 2016, August, we had the AU meeting in which our NCD Alliance, regional NCD Alliance, was represented by the Vice Chair, Professor Mchumbichi from Rwanda. And there were discussions on how to engage NCDs through the AU group, and issues about funding were quite prominent, and mechanisms of funding through primary healthcare was mooted at that time in the ages of universal healthcare. Again, in October, Mauritius, WHO Afro had another meeting on mechanisms of engagement of civil society organizations in the Afro region, and especially in the area of NCD monitoring framework. So a document produced by WHO on mechanisms of engagement of CSOs in the NCD monitoring framework was produced and is currently under implementation. In January this year, as a follow-up of formation of an African NCD network, an African NCD research conference was convened in Nairobi, and a global and regional NCD research collaboration mechanisms was formed, which proposes to have an annual NCD research conference from the first quarter of 2018. In August this year at Victoria Falls in Zimbabwe, the WHO regional committee meeting, the 67th one, was convened, and there were several agenda items, of course, but agenda items 9, 10, 11 had direct connections with the NCD prevention and care in the Afro region, while the agenda item 12 dealt with a framework for integration of essential NCD services into primary health care. This was a good opportunity for us to advocate for NCD prevention and care from the primordial level all the way to primary care. We had a side meeting, a psoriasis side meeting, sponsored by the Psoriasis International Organization. This meeting was graciously chaired by Dr. Shongwe, who is the NCD Afro lead, and was opened by the WHO Afro Regional Director, Dr. Moeti. And this again was an opportunity for us to find a way of engaging civil society organizations on NCDs in the national and sub-national NCD efforts. So a side meeting with Dr. Shongwe was convened, and the idea of a WHO Afro African NCD Alliance Network joint meeting in the first quarter of 2018 was mooted, and a date for a planning meeting in Brazzaville is being worked out. So coming back to the meeting, the next slide, please. Next slide, please. Coming to the actual meeting, the meeting was for 5 days. Day 1 and Day 5 were basically administrative, with Day 1 housing the opening address by the Director General. The meeting was actually opened by the President of Zimbabwe, Robert Mugabe, and thereafter we had some other sessions and an opening cocktail. The Day 2 basically dealt mostly with the regional strategy for management of environmental determinants of health in the Afro region, and later on sexually transmitted diseases and the international health regulatory framework in Africa, followed by sessions on yellow fever. And it is in Day 3 and Day 4 that most of the sessions relevant to NCDs were tackled. And RC 67-9, which is the agenda item on reducing health inequalities through intersectoral action on social determinants of health, was particularly topical, although not necessarily specifically meant for NCDs, but had a lot of relevant policies and action plans that are relevant to NCDs. So it is in here that recommendations were made, and we basically were looking for need for sustainable actions across sectors with a whole life, whole government approach, and integrated people-centered health systems approach. And issues of food security and disparities were raised, and education and also policy and regulation legislation and regulation frameworks to promote intersectoral collaboration. Monitoring and building evidence on health inequalities was also emphasized. And some of the actions was to make sure that we establish sustainable collaboration mechanisms, and also to look at member states' adoption and implementation of intersectoral action, and also to see that member states address the changing landscapes of health that are related to health inequalities. So looking at RC 6710, which dealt with the framework for health systems development towards universal health coverage in the context of sustainable development goals in the African region, the priority interventions and actions were to improve availability of essential services for NCDs and other diseases, and to have a set of priority services that should be defined across the life course, from infancy all the way to pregnancy and delivery and aging. We also looked at the scale-up of coverage with essential health interventions, including health promotion for communicable diseases and non-communicable diseases, and also routine and emergency services, rehabilitation and palliative care. There was also protection of populations, especially vulnerable populations, and effective health services, and measuring and monitoring performance of the health system as part of this framework. Looking at R6711, which is the African Regional Framework for Implementation of Global Strategy on Human Resources for Health, in accordance with the Workforce 2030 strategy. The vision basically is to accelerate the progress towards achieving universal health care in the member states, and to increase access to skilled and motivated healthcare providers in the region. And also to guide the efforts of the member states in making adequate investments in availability and accessibility of quality health workforce. So the targets by 2022 were basically 4, that all the member states have by 2022 have institutional mechanisms in which we can be able to coordinate the health workforce, and 50% of the member states have regulated mechanisms to promote health workforce safety and oversight, and 50% of the member states have established accreditation mechanisms for training institutions, and thirdly, 50% of the member states have human resources for health investment plans, and 50% also have sort of developed national health workforce accounts and observatories and regulatory mechanisms. Now, by 2030, looking at those 5 goals, we are looking at achievement of all these goals by half of the member states. Now, going to the agenda number 12, which basically dealt with the regional framework for integrating essential non-communicable diseases services in primary health care. The targets here were to, apart from the ones which were mentioned in the actual discussion document, there was a very vibrant discussion, especially from South Africa, Ghana, Kenya, and also Botswana and Nigeria, on inclusion of community engagement, multi-sectoral community engagement by community health extension workers and community health workers for behavior change communication strategies, especially for NCDs. And this was adopted. And some of the targets, other targets and milestones were by 2020, 24 member states should have adopted and should be using the WHO PEN, and 50% would have human resource for health training for NCDs at primary healthcare level. 50% would have systems of coordinating NCD, collecting NCD mortality data routinely, and 50% would also have defined and supplied essential medicines and technologies for NCDs at primary healthcare level. Now, using the same 4 targets, by 2025, we would have 38 member states who have already adopted and using WHO PEN, and 80% would be having human resource for health training at primary healthcare level, and 80% would have a system of collecting NCD mortality, and 50% would actually have a defined list and supply of EMTs for NCDs at PhD level. By 2030, we expect that 47 member states would have adopted and used WHO PEN, and 100% would have human resource for health training at primary healthcare level. 100% would have a system of collecting NCD mortality data routinely, and 100% would have defined and supplied EMTs for NCDs at primary healthcare level. Moving to the next slide. Next slide, please. Yes, so the meeting ended by deciding on the next WHO Afro meeting and the agenda for the same. And we were happy to note that in this agenda framework, there was an expansion of the inclusion of NCDs with the Agenda 13 being regional framework on diet and physical activity in the African region, and Agenda 14 progress on the achievement of the 4 time-bound commitments on NCDs, and Agenda 15 region strategy for revitalizing and strengthening district and local health systems, and 16 regional strategy for strengthening hospital and clinical services, including those for NCDs. So in conclusion, next slide please. NCDs are eventually being recognized by the African governments and other regional bodies such as AU, East African Community, and SADC as important health problems, and this hasn't been routine in the past few years. WHO also, especially WHO Afro, has now firmly entrenched NCD in its agenda in future regional committee meetings and activities. And Afro region still has significant other health problems to tackle in addition to NCDs, and therefore need for integration of health services and efficient utilization of resources for health, including human resources for health, and the need for multi-sectoral approaches for NCD prevention and care. Next slide, please. So mainstreaming of health in all government ministries and all sectors becomes important, and the multi-sectoral mechanisms that we mentioned, and having multi-sectoral commissions within governments. Increase in Afro-region budgetary allocations for health is still a major problem, with most governments allocating less than 5% against their Abuja declaration of 15%. Implementing strategies for sustainable healthcare financing towards universal healthcare, and strengthening health systems for NCDs through human resource for health strategies and the Workforce 2030, and supply of NCD essential medicines and technologies, and also behavior communication change strategies integrated into the communication strategies at community level. Collaboration mechanisms between NCD organizations in Africa with a joint advocacy front, and together with WHO and other global bodies will be important. And in this respect, we plan to strengthen the African NCD Alliance network advocacy to achieve this. Thank you. Thank you.
Thank you very much, Dr. Yonga.
Hand over back to Katie Dane.
Thank you, Dr. Yonga, for that presentation, and thank you, Josiane, for walking us through the other regional committee meetings. It's great to see that NCDs are kind of high on the agenda of regional committee meetings, particularly, obviously, in the lead up to the 2018 high-level meeting. Gerald, can I ask one quick follow-up question? Gerald, can I ask one quick follow-up question? Gerald, can I ask one quick follow-up question? Can you hear me? Gerald, I just wanted to ask one quick follow-up question, if you've got time. You're obviously talking about the fact that the Africa Regional Committee meeting was implementing or developing the new framework on NCDs within primary healthcare. Was there any discussion about the WHO Afro region coming out with a broader NCD action plan? Gerald,
Hello?
are you still there?
Yes, I had a problem with my microphone.
Yes,
okay, I'm with you now.
Okay, I just wanted to ask a quick question about whether there was plans for the WHO Africa region to come out with an NCD regional plan or framework.
From that meeting, there wasn't an expression of that, but what I saw is because of the low resource allocation for health in general, integration looked like what was really being discussed, and integration within the framework of universal health coverage, and also strengthening of the primary health care plans.
Mm-hmm.
But the encouragement of the different member states to have the NCD plans, and the NCD plans included within the universal health coverage and primary health care plans.
Great. Sounds good. And thank you very much for joining us, and thanks for all of your work, obviously, through the East Africa NCD Alliance and now the broader Africa NCD network. It's great to see more alliances emerging at the regional level. So thank you, Dr. Yonga. Let's now move on to our last agenda item, which is the Global NCD Alliance Forum that's taking place in just over a month in Sharjah in the UAE. Let me pass over to Josie Ungar-Leah to give us an update on where we are with the forum.
Thank you, Katie. So I'd just like to go over a few updates about the forum in December, objectives, outputs, outcomes, participation, and to run through the preliminary agenda. Next slide, please. So the forum will take place on the 9th to the 11th of December in Sharjah, and the main theme is stepping up the pace for NCDs, making 2018 count. Next slide, please. There are 5 main objectives for the event. Firstly, to further the Sharjah Declaration by facilitating advocacy campaign planning towards the 2018 UN high-level meeting. To convene the civil society network of national regional NCD alliances to share experiences, lessons learned, and connect with key stakeholders across sustainable development. Thirdly, to promote the engagement of people living with NCDs and youth in the NCD movement, including through launching the advocacy agenda of people living with NCDs. To strengthen the capacity of the network of national regional NCD alliances, and finally to build momentum on advocacy priorities for 2018 UN high-level meeting on NCDs. There will be 3 main streams for workshops: advocating for NCD prevention and control, secondly, breaking down silos and building synergies in the SDG era, and thirdly, sharing tools and strategies for NCD advocacy and mobilization. Next slide, please. Main outcomes will be mobilized and coordinated civil society towards the 2018 UN high-level meeting, mobilized youth and people living with NCDs as an integral part of the NCD movement, including the launch of the advocacy agenda. Thirdly, taking stock on progress on the Sharjah Declaration, including through the NCD Civil Society Atlas, which will provide an overview of national and regional NCD alliances' work and make a case for the important role played by civil society, which I'll provide a bit more detail on later. And finally, strengthen the ability of national regional NCD alliances to achieve common advocacy objectives. Next slide, please. In terms of delegates and participation, it is an invitation-only event, and I'd like to take the opportunity to remind anyone who's received an invitation to please register as soon as possible if you haven't already done so. Participation will be wide-ranging from national and regional NCD alliances, youth and people living with NCDs, approximately 30 people, civil society groups of cross-cutting areas of relation with NCDs, NCD Alliance supporters, and global stakeholders, including multilaterals, major donors, NCD funders, government representatives, and international NGOs. Incidentally, the youth participation is a very important aspect, and participation was competitive, and we received over 260 applications for these spaces, so there's very keen interest from the youth advocates. Next slide, please. To go into a bit more detail about the youth aspect, there's a youth planning committee led by NCD Child, IFMSA, YPCDN, and others. And there will be a youth pre-meet with these key objectives to convene youth advocates from across the 6 WHO regions to share experiences and best practices for a sustainable NCD prevention, management, and treatment agenda, to introduce key frameworks, declarations, and resources to prime attendees ahead of the Global NCD Alliance Forum 2017. Thirdly, to provide context and timeline of the current Global NCD development agenda and the lead up to the UN HLM. To discuss meaningful youth advocacy across key stakeholder groups, complete a delegate-led prioritization exercise to identify key areas for action, and finally, to draft a time-bound specific call to action for youth advocates ahead of the 2018 UN high-level meeting. Next slide, please. And now to run very briefly through the preliminary program to give you a bit more idea what will be discussed during the forum. Firstly, there will be the pre-forum youth meet, and then on the first day we will have an opening ceremony and opening plenary, as well as pre-forum advocacy planning meetings, which will provide a space for civil society to coordinate efforts and lead up to the 2018 UN high-level meeting. Next slide, please. On the second day, we will begin with the plenary sessions. There will be 3 of them, followed by the workshop streams. The first one will be Uniting the NCD Movement for 2018, Framing the Narrative, Advocating for Action, and Amplifying Voices. And the 5 workshops will relate to investment and financing, access and achieving universal health coverage, joining forces to tackle determinants, promoting the meaningful involvement of people living with NCDs, and finally driving national planning on NCDs. And the format of these workshops will be to include a generous amount of time to group activities, to encourage exchanges between delegates. The workshop co-leads will ensure that speakers will be leveraged from forum delegates, and they're also encouraged to involve youth, people living with NCDs, and national regional alliances in the workshops. Next slide, please. Later that day, we will have our second plenary on breaking down silos, building synergies, accelerating NCDs and the 2030 Sustainable Development Agenda, with a stream of workshops that will tackle the topics of women's and children's health, NCDs as a barrier to poverty reduction and development, using the law, human and planetary health, and ensuring sustainable, healthy diets for all. Next slide, please. On the third day, we will have the third plenary, Growing the Movement, Equipping Civil Society to Fulfill its Roles in the NCD Response, and the workshops will go through accountability, using evidence, sustainability, the best buys, and multi-sectoral action to NCDs through workplace wellness. Next slide, please. The 4 key outputs will be, firstly, 2018 high-level meeting advocacy priorities, regional plans for 2018 UN high-level meeting action, thirdly, the advocacy agenda for people living with NCDs, and finally, the NCD Civil Society Atlas, which I'll now talk a bit more about. Next slide, please. So the NCD Civil Society Atlas builds on the situational analysis of national and regional NCD alliances that was conducted in 2018 and the Sharjah Declaration on NCDs, also of 2018. It provides a snapshot of the current state of global NCD civil society in different regions and across a variety of thematic areas. These are the 4 A's of access, accountability, awareness, and advocacy. It will share good practice among existing and potential national and regional NCD alliances to foster knowledge exchange and innovation. It informs and supports advocacy efforts on the role and importance of NCD civil society. So this was an open call for submissions from the national and regional NCD alliances all over the world. And we received 53 submissions from 31 different national and regional NCD alliances. We now have a list of 38 case studies that are being elaborated on and written up, assessed along 4 key criteria of coordination, results, innovation, and replicability. And we will look forward to launching this publication at the forum. Thank you. That was it.
Thanks, Josie, for that really good presentation on the forum. We are very excited about the forum coming up. It's not only a fantastic program, as hopefully you'll have just seen, in terms of covering a huge, diverse range of issues, but also for us, the timing is really important, as Josie said, because obviously
it looks like Katie's line, Dane's line has disconnected. One moment while I reconnect. And Miss Katie Dane has now reconnected.
Sorry for that. I think I must have got reconnected because we've obviously gone over our time. I was just finishing by saying we are very pleased and excited about the forum. It's not only an important event in terms of the timing of it, because it's obviously just in the lead up to the 2018 high-level meeting and a great opportunity for civil society to come together. But also I think what this forum will do that will be different from the first one that happened in 2015 is that obviously one of the main purposes of the forum is to convene our alliances and networks. And I think what we're going to see in this 2017 forum is that the first one was really focusing on bringing together the national and regional NCD alliances for the first time. At that point, I think we could say we had around 25 national NCD alliances around the world. What's so exciting about this forum is that that number has grown to over 50 national and regional NCD alliances around the world. And what we will be doing at the forum, as Josie just explained in terms of the atlas, is shifting from talking about who these alliances are to actually talking about what they're doing and the impact that they're having on the ground. So I think what we're going to see is some really interesting illustrations of the impact and the value that civil society is having on NCDs, and obviously thinking about the next year in the lead up to the 2018 high-level meeting. So thank you, Josie, for that presentation, and apologies everyone for getting cut off at the end there. I think that ends the webinar for today. We've covered a lot of areas. Just as a reminder, the PowerPoint slides and a recording of the webinar will be available on our website for you to download and listen to, and for those that haven't been able to join us at this point can listen at any time in the future. A big thank you to all of our speakers from the NCDA team, as well as Dr. Gerald Younger, to hear from the regional perspective as well. And just to say that we'll have our next webinar shortly after the forum. It will be kind of middle of December, where we'll be able to report back on the Global NCD Alliance Forum and other, no doubt, many other global and regional policy issues on NCDs. Thank you for joining. Goodbye.
And once again, ladies and gentlemen, that does conclude today's conference. We appreciate your participation.